So
And
the
we'll talk about that because this is okay. Are you ready, Shirley?
right.
Not yet. Let's go.
Yeah.
Welcome, everyone. And this is Upstream. We welcome you to our platform. We have a new guest today, Dr. Paul. Welcome, Dr. Paul, meeting with us. And,
Thank you very much.
and we have Shirley Grukowski, and we have been Shirley and I'm Victoria DaCosta, a dental hygienist, and also Shirley Krakowski. And we have our platform Upstream. And what we have been talking about are all the intricacies of the mouth and body connections over the last few weeks. And we saw very important to invite a new guest, Dr. Paul. And Dr. Paul, would you like to introduce yourself?
I'm Dr. Paul. I have a history of chiropractic. I've been a chiropractor for many, many years. But the main thing I'm doing right now is I'm working on protocols for treating chronic pain. And I think we've made a major breakthrough in the treatment of chronic pain. And we can take almost anyone in chronic pain and without trying to make a claim, I'll say that our last study at a convention with random people 35 in chronic pain, our average was over 87% symptom free. And so that's what we're doing, and we have a way to stabilize that so that it becomes a permanent or near permanent correction. And that's what I've been working on. It's recently we developed new protocols instead of manipulation like I've been doing for years, teaching manipulation to chiropractors and MDs for this problem. I developed a pressure technique that actually works better, and so it's available now to holistic practitioners.
So, Dr. Paul, when we met a few weeks ago, we really clicked well when we were talking about the need for teamwork with chiropractic and dentistry, and where the dentist and the chiropractors can collaborate, and not just dentists and chiropractors, but a team of well care providers that have like-minded goals in place for a patient's care healing. Many times I've heard patients say to me after I've taken their dental medical thermography scan reports how much pain they've been in for years, chronic pain. And or they've had a situation where they've mentioned to a provider and they spent thousands of dollars with a certain provider and they sort of got relief, but then it came back the pain. Um, what I see today is a topic that we can discuss about teamwork and collaboration. And how do you see the dental industry role coming on board with collaboration? And what are some of the pros and cons that you see now?
Well, I think that there's a number of different ways we can go, but I'm not sure which one is going to work out the best at this point. But I think that the need for them to come on is because chiropractors, since well, shoot, since I was in school, many years ago, we've always known that the condition of the mouth affects the alignment of the upper vertebrae. Now, it may sound a little bit of a stretch, but it's not. And
Mhm.
so the other thing, I'll give you an example that we found that stress will affect the alignment of the upper vertebrae drastically, and you wouldn't think that that would be true, but it absolutely is true. And so, trying to figure out how to reach the dentist who have already been taught this in school, they know it too, but they're busy with doing what they're doing like everybody else does. So most of them in school, they're not really taught what to do with the mouth to affect the alignment of the upper vertebrae, nor are they really taught the importance of what happens in that upper neck as far as your total health. For example, in my field, we have found that the symptoms of fibromyalgia, CRPS, trigeminal neuralgia, which the dentists do have something to do with, and most of your neuropathies and chronic pain disappear when we just apply our test to the upper neck to find out if there is that encroachment. So how much of that comes from dental alignment or dental, or myofascial problems, we don't really have a real understanding of that because nobody's really done any work to document it, especially when it comes to these really severe chronic pain patients that I see that are having the pain because of that upper cervical problem. And so there needs to be some research for one thing. And then the other part of that is there needs to be some joint effort with some dentists who would take more of an interest in this kind of work. And there's been some really famous dentists in the past who've taken a real serious look at it, as you know, and have documented it. And we know that there is, that connection. But in today's situation, oftentimes people don't really they don't want to move very far out of what they're just normally doing every day. And sometimes it's because of the powers that be that will give you a hard time if you came up with something new. In my case, I've been chased by a lot of people for coming up with what I came up with, and it's okay. It's kind of like the guy who discovered ulcers. It took 17 years before they finally believed him, and everybody now goes, well, yeah, we cure ulcers that's caused by a bacteria, but nobody believed him for 17 years, and they made fun of him and ridiculed him, and he stood his ground.
He got a little bit lucky because usually it's a 20-year turnaround. That's how long it takes to get new people into the universities and have an open mind. And it's painful to watch closed-minded people, as I'm like always searching for the newest thing and what's progress and how do we move forward, and how do we work together. That's my new like driving passion, because it's more and more obvious every day that we can't not work together with different disciplines, because we are all working in a shared domain. The human body has many pieces that interact with many other pieces. And so it's really important that we all work together.
I had an orthopedic surgeon friend of mine, and we were part of a group that would help people and stuff in town. And I met him at one of our get-togethers, and he goes, hey, what have you been doing? I told him what I was doing and told him how I'd been working with fibromyalgia patients. And I told him, I think I found the cause of fibromyalgia. And he looked at me and he said, if you found that, you have found the find of the century. And he just and I got this feeling like he just kind of patted me on the head and walked off, like, that's pretty cute, because he just didn't even come. He didn't have enough belief in that to even sit down with me and go, okay, what did you find? And how's that?
Yeah. What was it? It's a lack of blah, 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 blah. All you do is take a pill every day. And that's what they're always looking for, right? It's just a reason to write another prescription. Seems like.
It's really a shame. It's really a shame that they have been locked so tightly into the pharmaceuticals. And that was done on purpose, that was funded that way. And if you don't, you'll lose your license. I have a friend, Dr. Schellenberger, and he's very famous in the natural.
Oh, Frank?
You know Frank?
Yes.
Well, I told you he was very famous.
There you go.
Yeah, he's a good friend of mine. And we would work together on difficult cases, and I'd call him up and we'd share patients, that kind of thing. I'd send my fibromyalgia patients down to see him and say, oh, I'm having some difficulty with this one. What do you think of this? And next thing you know, he's got him on ozone and doing all kinds of things. And anyway, he's a really good guy, but they chased him and beat him up and ran him out of California. And what was he doing? Some really good, innovative things that were helping people get well. That's what he does. And he still does a great work. Now he's got this huge vitamin company he's promoting on. He's the new Dr. Guntry, I think.
Mm.
So, anyway, it's kind of like that. So if we're going to do something new, it's big. Now, what you're doing is not something that's so new. It's just not well accepted.
Yes.
What I'm doing is not well accepted. not
Right.
well exposed. And just the idea that the face is shrinking and that we have demonstrable proof that,
Yeah.
you know, not only are humans getting bigger in the United States, but their faces are getting smaller, and how all of that kind of goes together in our effort to
Well,
solve these problems.
we're we're doing interracial marriages right now, and without doing anything political about that, or even saying anything political, because I don't have a problem because I'm married to a Chinese woman. But the problem that is created, and this was actually taught in school in the textbooks, is that with interracial marriages, sometimes you end up with different sized teeth than you do different sized jaws, for instance, and so forth. So you end up with some problems, you know, that the orthodontist might need to look at, because your mouth, the teeth don't fit in your mouth anymore, for example, in some people, and so they end up very,
that
very
has
crooked.
been disproven. So the problem is that the jaws are just getting smaller, and the teeth have not really changed size at all.
No, I
So
wasn't saying that she's changed size. I was just saying that for, you know, maybe a Chinese person might have, like I have really small teeth, so I don't have to have my wisdom teeth pulled.
you
But
have
anyway, I was just saying
appropriately
that they were
sized
saying that
jaws.
the genetics sometimes can
Yes.
not match, and that you end up with big teeth, smaller jaws for whatever reason. Why are the jaws getting smaller? I don't know.
Well, it's
The
all going to
jaws-
go back to what we talked about earlier, is the neurology. So looking at the cranial nerves and the signals, and I see this with Dr. Fonder's work talked about in embryo stages, how the teeth are formed through the neurology first and then the neural crest in the infant. So looking at this neurology, that's where I've seen the greatest correlation between the medical and the dental, is that with assessing the mouth, the size of it, the position of the jaw, how the teeth touch each other in chewing, or they don't touch each other in chewing, can affect the neurology in the brain and in the spine, in the structure of the vertebrae. That's what I've seen in the thermography scans, is the stresses. And I've seen a lot of sleep apnea, a lot of closed, limited airways. I've seen a lot of frontal lobe stress, especially a lot of trigeminal nerve. I would say that's about in the 90 percentile. People have that stress in that nerve. And why is it? How can we use that information to, I guess, treat in a way that it would help to eliminate a lot of also emotional factors? Just the vagal nerve alone goes through the trigeminal, and the vagal is part of the midbrain. In my research, in depression, anxiety, people seem to be living in a very high sympathetic mode versus parasympathetic. And I think in the collaboration of the providers, we'll be able to at least give people some sort of quality of life and relief of that sympathetic stress that seems to, they sleep with it, they wake up with it, they communicate in family dynamics with it. And I see it more and more affecting family relations, and even the understanding of why there's an increase in ADD and all these attention factors in the children and also adults. What do you think, Dr. Paul? I mean, I think that we have an opportunity to kind of wake up the dental industry and say, hey, if you see grinding, there's something there to pay attention to. That's not just grinding from the trigeminal nerve and put a bite splint in. There's more to the treatment in a collaborative world. Like Shirley was saying, shared domain.
Well, thank you for asking me that. Those are really good questions, and you actually brought up a number of things there that are very important. The vagus nerve has direct communication with the first cervical nerve. We have found, and then you brought up the fact of people being in sympathetic. In sympathetic, what we have found, and this is observed widely. It's not just something that happens once in a while. It happens almost every single time we put on, well, it happens every time we put on seminars, but it happens with almost every patient. So, or client, however you want to put that. So
Right. Yeah.
when we do our decompression test to take the pressure off of the meninges, which is what we have found is causing the problem, and at least that's our belief system. And so when we put the pressure, we take the pressure off of the meninges, it takes the pressure off of the nerve roots that are firing that are putting you into sympathetic. And so usually within 5 minutes, your sympathetic system turns off completely and you're in parasympathetic and you're relaxed again. At the same time, if there is a trigeminal nerve issue where you have, trigeminal neuralgia, it usually shuts off also, and the pain in the face goes away, almost always within 5 minutes. Sometimes it takes 10 minutes. And so
That's huge.
kind of going from there.
That's huge. Most treatments don't offer that. They put them in bite splints when they see the grinding on the teeth, or they have
that might be necessary. I don't know because that's not my field. But I do know that when we take the pressure off, that the trigeminal nerve quits firing and the pain goes away. I've got a woman coming over. I don't normally see patients, but it's a friend of a friend. He said, "Look, I got this friend and she's got Bell's palsy and it won't go away. And it's been there 5 months now. And she's really depressed and feeling awful about, and she hides in the house." And I said, so I talked with her yesterday. I said, "Look, come by and let me take a look at you and see if we can help." I had there's a society for Bell's palsy and facial problems like that. And the woman who was headed that group up, who spoke before Congress, was at a convention for this in San Diego when I was doing a training there. And so somebody met her at the bar, sent her over, and she came in, and I worked on her, and I said, excuse me, I said, "Somebody bring me a mirror." And so they brought me a mirror, and I had her look, and her face was back to normal again. It had been that way for like 10 years. And so how this happens and how it works, we really need a lot of research. But from our standpoint, we have our theories about it. But we know one thing for sure: it works, and it works almost every time. Will it work on all Bell's palsy? I don't know. I haven't seen that many of them. It works on seizures. Every person I worked on had seizures. They quit. But that's only been about 10 people who had seizures that came in through the years. And they quit like with the first few days, they were gone. We just saw a little girl the other day. She was having a seizure every single hour for 8 to 17 minutes. Their mom timed them, and they just wore the family out because they were all around the clock. And then afterwards, she couldn't speak for 20 minutes. And then she'd have like this little slot of 20 minutes where she was halfway normal. And at the same time, her foot was in unbearable pain. She couldn't put it on the floor, and she had headaches, and that was primarily her. And so I went to put her on the table because the family wanted me to take a look at her. And we were at a seminar in Atlanta, and we laid her back on the table, and she went into a grand mal. She's foaming at the mouth and everything. And you know how those are scary.
Yeah, they are.
I think they're scary even if you deal with them all the time. They're still scary. And so I grabbed her neck and I put pressure on it. And within 45 seconds, she was totally awake. She could speak this time afterwards. And her family was like, "What did you just do? You just stopped her seizure." And we're sitting and questioning her headaches better, and her foot pain was completely gone. She could get up and walk on it. So that's like, wow, how in the world did we do that? Well, we know we can do it, and we do it routinely, but we don't know how deep this goes because we see things like OCD disappear. But the thing I really wanted to touch on that you touched on and answer that question was that we have all these children. Somebody said it's up to like 20% right now of the children in the United States are on medication. That's not okay. That is really, really, something is very, very wrong. I don't think God created us that badly that 20% of our kids need to be on medication. But I do think that we have initiated something called sports where we're wrecking our children. We take little kids and put them on trampolines and they land on their neck, and we think that they can do that, in this young tender neck that isn't even developed yet, without repercussions. And so we end up with these kids that can't sleep, that can't feel sick in the morning, don't want to go to school. They go to school, they're miserable, and they don't do well. And the teachers think that they're troublesome because they're grouchy, because they don't sleep. Then they get home, they don't want to go to sports, they don't want to do homework, they feel bad all the time. And so so they end up in what you would expect where they would end up is the school doing an evaluation. They should. But the outcome of that evaluation is almost always, ADHD, and puts you on Ritalin or some kind of speed when you're young, which calms you down. And so we end up with all these kids on medication, and these kids, and then we're surprised that our kids are taking drugs when they're in their teens. Why would we be surprised? Because this medicine they put them on creates addicts. And so we've got young kids now that are taking medications that's creating addicts. And the kids I've seen like this, and again, I haven't seen enough of them. I work on them. They come out of it. They wake up and they go, "What just happened? I'm here. I'm back. All those bad feelings are gone." And we see it over and over again. I haven't seen enough of them to know if it's going to work on everybody, and I doubt it will, because some of that may be coming from, and I hate to bring it up, inoculations. We're taking our kids and we're giving them so much to deal with at such a young age that it's we've already got plenty of science to show that it's causing autism, but yet we keep doing it. And so how is that done? Our inoculation, you inoculate your puppy, he doesn't get parvo, and it works. Come on. So we got to say it works. So inoculations, if they're good, at some level they work. But if we're going to give them, how could we give them? And at this point, I think the studies have shown very clearly, especially the German study, that inoculations are you're better if you don't get them than you.
The way that we do them here, I think, is problematic. That we give them so many all at once, where we don't know how they're competing. We don't know anything. And that's the biggest problem. They probably do work. They probably work great. We don't know, because we're just jamming them all together in this tiny body. That new human has to triple in size. You're born at 7 pounds, and by the time you're 1, you're 25 pounds, and that can't be interfered with.
Robert Kennedy said the same thing. I'm so proud of him. But I think he may not get confirmed over his stance on vaccinations. But he said the same thing. We're giving too many too fast.
Too many too fast, for real. We spread them out. When we bought our dogs, we had to sign a contract that we would only take them to holistic vets. Well, guess what? There's not many around here. And so it took a while to find someone. And it was there. They have the mercury-free ones, and they have a really extended schedule. They have this whole big system of how to keep these dogs protected. They won't do the neutering until the dog's a year old or more, because all of that stuff impacts these dogs. And to go back to your sports conversation, we had to carry our little dogs up and down the stairs for, 7 or 8 months, because they said, don't let them jump up and down the stairs. How do you keep a little dog from going and jumping up and down the stairs? It's like keeping a 5-year-old off of a trampoline. Just can't do it.
They should do that for old folks too. They should carry me up and down the stairs.
So, the vets have a really good handle on a lot more of these things. My mother-in-law was a kook. They called her a kook. She, it was the 70s, and she would be in her pro-life rallies, and she would write letters to everybody and no vaccines and all of this kind of stuff. She had a big cabinet of supplements, and she would pawn off these supplements to everybody. And every day I'm like, dang it, she was right about that too. Dang it, she was right about that. So far, we haven't been able to prove that our past presidents were all robots. So that piece is still, just because there's that kooky part doesn't mean all the rest of it is garbage.
Right.
So
and that's where we are with
this
dental interfacing, the work that I've done, and how do we interface that with dentistry to help the patients take the next step. And so,
Chisel, 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 just chip away, chip away.
Well, I think that what's going to be the chisel is, in the quick way, is thermography. Thermography, the veterinarians have integrated that quite quickly with racehorses and with animals. It's just a little slow in the United States. Thermography is used quite a bit in other countries for investigation and measurement of stress, neurology stress, neural stress. And what I see is when I'm taking these images and overlaying them on the anatomy of the body parts, we can see the stresses in the nerves. And the exciting part is, and Dr. Paul, you haven't had a chance to see, you've seen some of the reports, and I gave you access to look at those. Some of the reports on those cases have been chronic for years. But I believe that dentistry, having an added on assessment tool, will be able to recognize earlier than later that there's stresses in the neck.
I think that that's marvelous that you're doing that. And so the big deal is, how do you sell that and get that to the dentist so they start using it?
And why?
And and the other thing is, there's nothing wrong with a dentist having, one of his assistants trained in the testing we do, and they could bring them in back and do our testing, use your thermography. There is a whole nother field there that's open to dentistry that
it
would
really is.
Well, one of the things that make them, they'd be getting people well that they never even thought they could help before, but also they'd be overwhelmed. I mean, we were so busy, we were seeing 165 visits a day in a town where people had to fly in and stay in hotels to see me. That's an amazing thing. And that's what that shows. And the point of that, not is that I was so great. The point of that is that these people, that it does work, and these people are dying just looking on the internet every day. Is there anybody who's found anything new to help me? And that is, that's the whole group's like that. And if your spouse was like laid up in bed and couldn't sleep and taking all these drugs, what would you do and what would you pay to get them well?
Well, and I hear it
would be
all the time.
You do anything.
They're on oxygen. CPAP is a big a solution right now. And but I tell you, I can look in the mouth and see a lot of systemic issues, just the way the teeth are being chewed on, a vertebrae is out of alignment. Or if I ask questions and look on
Could you say that again? Could you say that again and kind of pull that together where I can understand a little better? You said you can look at the teeth and see vertebrae out of alignment?
Yes, I can. If a tooth is chewing if its biting surface is chewed in a certain way, chewed down, and there's no equilibrium on the chewing, I can tell that the neck is out of alignment because the jaw is out of alignment. And that is going to put the strain on the ligament. And the research I'm doing, and also, Dr. Funder talked about it as well, is the neurology there is out of alignment. And maybe the person was in a car accident and had a neck injury or a whiplash, or even that happened to me. My bite changed after the airbag went off in the car. My bite was never the same. And so my chewing surfaces. And so you might put a pressure more on one side of the other, and you might chew pressure on a tooth that would make it weaker over time, especially if the neurology in that tooth is weakened. And also the tongue. I can look at, and Shirley will talk about the tongue. That's her specialty as well, is just the enzymes or the lack of enzymes produced in the mouth to digest food, because the equilibration on the teeth are in synergistic movement. And we talk about a little piece of paper that they always use to check your chewing surface. But really, these are little indicators and clues we can teach and show and catch early with even thermal images, so that we can see that there's more stress on one side of the neck than the other. And then look at the mouth. You can see inside the mouth as well. I've been imaging inside the mouth now for a few months and see the stresses on the teeth. Heat, more stress on a tooth than another tooth. So yeah, I can say that with surety that you can have these little indicators to work with a team of providers to help correct the areas. And that's how I can see looking in the mouth, especially with people that are clenching and the way the teeth are worn down, especially if the occlusal teeth are worn down in the anteriors. That's, those are indicators. Those are just all indicators that there's something out of whack and something out of balance.
So you had mentioned that the enzymes will change in the mouth with with dental problems. Do you
And
have
also, yeah,
documents on those things that I could
oh,
use?
sure. Shirley, do you want to talk about that? The parotid glands not being stimulated because of the facial nerves and the lack of movement in the ligaments.
There you go.
Okay,
Well,
that's what it
that's
is.
kind of right. Now, I believe that because I know that when we have an upper neck problem that's creating symptoms like fibromyalgia and so forth, that all the hormones in the body go off. They'll run all these blood tests, but they forget to run hormones because
Yep.
in almost everybody you'll see a lack of testosterone because you don't need that system in sympathetic. And the brain chemicals are off too, but almost nobody ever runs that.
Right.
So they're missing a lot of things oftentimes just that they could find. But I can see how, if that's a problem, how that could easily affect the enzymes in the mouth, which affect digestion. And the reason for that, you think about it for a second, is you don't need digestion when you're in sympathetic because sympathetic is made for running and fighting. So the whole system, all the way from the mouth down to through all your intestines, it shuts down. It doesn't work well. Then you put food in, the body wants to flush it out. So you end up with irritable bowel syndrome, which can lead to leaky gut syndrome, which leads to autoimmune diseases, and on. The whole thing goes. But we have an epidemic of people living in systemic right now. And then they're so tired, they wake up and on top of that, they'll put coffee on it
Oh,
and tea on it.
yes.
And
Yeah.
then which makes the whole thing worse. And then by evening, they're
Yeah.
so exhausted and so miserable and so cranky that nobody can live with them.
And not only that, but I see it when I was a hygienist. Sometimes I would see tissue so sensitive to any kind of scaling. It would just bleed. I would call it, I always called it gum stress. But I could tell their body was so stressed, the gums were so, the body was so weakened that you could floss in between Shirley, and there'd be blood. Or even if I just did my normal cleaning as a hygienist, I could literally soak 26 gauzes of blood.
Oh, come on.
Yeah, I have a picture of it.
Oh, shoot. Those people are about ready to lose all their teeth.
No, they're just, their body's so sick and in sympathetic
Yeah.
mode. They haven't been at rest to repair. There's just no repair going on. And that's
so.
where, and there would be hardly any plaque or hardly any tartar on their teeth.
Really?
Yeah.
What it sounds like, that sounds like scurvy,
Well, I had a case where this woman brought in her 4-year-old boy, and dentistry, that's one thing I'll say about dentistry. We start you at 3 years old to come in, right, Shirley? We come on in at
First
3.
tooth, it's been down to the first tooth, and now
down
it's
to the first
sooner.
tooth. Yeah.
Yeah.
This woman, she goes, I'm brushing, I'm flossing, I'm doing everything for my child, and I feed him good food, but his gums still bleed. Now, this is a case for a team. You can't tell me that this isn't teamwork here, that a collaboration of shared domain. The child's deficient somehow, and it's showing up in the tissue in the mouth. And we're saying because the eye whites are yellow, that's not liver. When the eye whites are yellow, it's liver. It's not something wrong with the eye. And we're doing that with the gums in the mouth. We're saying something's wrong with the mouth when it's really something in systemic. And it took a European doctor to tell me this over and over. He said, you're looking in the wrong place. It's systemic. It's not the mouth. The mouth is the communicator. It's the messenger. So
Yeah,
yes.
you would. So what would you say it is? Because glaringly, it looks like lack of vitamin C. But but what would you say? What else would cause that?
Oh, I would say an assessment with a thermography would show. I would see immediately where those stresses are in the neurology. And I'm sure it's in the neck. The vagal nerves are shut down in the neck.
Could be the vagal nerve is a real serious problem
Oh,
that I
it's a
deal
huge
with on a
problem.
daily basis. But
Yeah.
it's pretty easy for us to turn that off, and the sympathetic off and let that everything go back to normal. So I'm
Right.
happy.
No doubt the child wasn't sympathetic because the body couldn't repair. And so, and here we have an opportunity in the dental industry to pick up these underlying medical conditions that are serious. whether they be strokes, heart disease, dementia, Parkinson's. We can see it, right? I've seen it, Shirley.
Well, the elephant in the room is, this is important. Dentists have to know this is important. Why, why isn't why isn't it being taken seriously in dentists all over the world doing this? Taking a
I
little.
think it goes back to the education. In dentistry, they're just focusing on enamel towers and microcarpentry to repair the biological dimensions of each tooth. And that's where their huge focus is. They spend a lot of time on dental materials and never look at the airway. I think when we were talking on the phone the other day, how I was a hygienist 40 hours a week from 86 all the way to 2003. I don't know, 10,000 throats maybe in that amount of time. Never saw an airway till 2014. And then I was like, well, shit, pardon my French. What in the heck? How come, it's just not there? And I went through all of my textbooks. I'm writing another textbook chapter for an upcoming dental hygiene book. And I didn't see any screening tools in any of those textbooks. I think I have 5 where they talked about the airway as a problem, or that when they talked about oral breathing, it was still about tell them to close their mouth. And then that was it. Not that this was a big problem of dental crowding, or that the tongue was not a good match for size of the mouth. And, all of these other pieces of information that you'd think you're right there. Why wouldn't you notice? All of our gagging patients, that's an airway protective mechanism to gag as soon as somebody comes, this close. So we need the chiropractors to open this up, because that gets compressed, and allow the airway to have some space and stop some of these dental conditions.
Well, surely you can say that. The chiropractors, and rightly so. It's not so much the chiropractors; it is the dentist telling me about their quote scope of practice.
Oh, well, there you go.
Outside the mouth, and their
shared domain, ladies and gentlemen.
Well, they're threatened and bullied. One dentist I met in Texas, and he said, I would love to work with a team environment, but I'm afraid I might get my license taken away. But this is where we can change the language, and we have new leadership in government, and we can say, look, we have now we have shared domain and responsibility to look and to share information. Why not share this information earlier than later, than wait for the case to break down in such a way that it's advanced? And this is, to me, where we're going to pioneer this communication breakthrough, because it's been a passion of mine for years, and also Shirley's. And I know, Dr. Paul, you're breaking through barriers like crazy right now. And what I see is the advantages of, okay, so the dental industry is part of the team. You can't take the mouth out of the body. And so the old textbooks were like 20 years behind, because I know in Europe, they train the doctors all in the same field of MD, and then they specialize in dentistry. So they all have that credential of MD, and then they have their specialty in the mouth, the nose, the ears. The problem in the United States I've seen and witnessed is the hierarchy and the status quo, that if you're at this level of education, you don't have the information about this level of degree. But that's not true anymore, because people are going online, and I hear doctors even mention in the dental field, the patients are going to Dr. Google. And people are wanting their information, and they're wanting answers. So they're searching for this. And the platform I see in the future right now is collaboration, shared domain. It's there. But they need the classes. How many times do I go to these integrative health conferences? They talk about it, but there's no actual implementation of systems.
There's no step-by-step
put in their business when they go back home. and they don't take their staff with them. So the staff has no idea what they're talking about. All they know is their routine. And now you're telling them you're going to add something to their routine and it's going to slow the clock down. So what we need is a way to educate the entire group in their businesses with videos and understanding that, hey, it's good to be part of a team. It's not a negative, and to look at your scope of practice as a contributing provider, not someone who could live in fear. And I feel for these dentists. They've lost their license when they tried to work in an environment that was so-called out of their scope of practice. Dr. Paul, have you heard this phase or this phrase of scope of practice? Obviously, if they're chasing you, they're saying that you're out of your scope of practice. I think
nobody ever said that I was out of my scope of practice, which was really quite interesting because I figured, the first week I found this, came up with the ideas and started working on patients and they started getting well with fibromyalgia. I thought to myself, you're out of your scope of practice. At least they're going to say they are. They're going to come take your license. And I understood right away that they were going to attack me. And so I had to make a decision. The decision was, do I keep my license? I'm already doing just fine. Mm-hmm. Or do I help these people and lose my license? Because eventually somebody, especially the chiropractic board, they're not the nicest group of people. At least they weren't years ago. I don't know what they're doing now. And they're looking for somebody to, and so here I've got this enormous practice and everybody's getting well. And now we're getting notoriety and people are hearing about us across the country. And it was a frightening thing. I finally came to the decision. I said, I've got to help these people. And at some point I'll just deal with the fact that I lose my license. And eventually, they got me on something. It was. I'll tell you what they got me on is I was on a podcast, radio show actually. It's very similar, and I think I was in Texas. I would do quite a few of those when I'd be on the road teaching, and the announcer said, and I didn't even know he said this until years later. But when he was announcing me, I'm thinking of, okay, what am I going to say? And I don't want to look like an idiot, And he comes on and he introduces me and says a whole lot of things that I wasn't really listening to. And part of what he said is, and this is Dr. Whitcomb from California, and he has found the cure for fibromyalgia. I didn't hear him say that. And then all I heard him say, isn't that right, Dr. Whitcomb? And I said, yes, that's right. And I went on talking. That bit me in that.
Pay attention.
That's the one that'll cost you your license for 2 years. And so anyway, and then I kind of threw some other things in there about note taking or something. But it's easy. If you want to take somebody's license, you just go into their office and investigate. You'll find something. If nothing else, you'll find some mistakes they made in insurance and get them for insurance fraud. It's real simple. But I've known a number of doctors who are doing a good job, like Dr. Schellenberger, in his cutting edge work that it's cost him his license in California. But then he went to Nevada and they said, yeah, we love you here. But it's okay. But, getting back to where we were, I think that the real thing that we need to look at, and we need to look at seriously, is a couple different things. How are we going to approach this and educate the dentist? And how expensive is that going to be? Because we're not a pharmaceutical house and we don't have all the reps and the money and the advertising.
Right.
And the other question is even if we do we make this part of one seminar and we both teach and educate about the importance of this working together and then teach how to implement it? Or do we refer to each other? So that I could have a seminar and say, look, maybe something else you might want to look at. But I would have to be marketing, if you will, to dentists.
Right.
And then I bring my program to dentists, which they can legally use in their back office. But then at the same time say, you might want to look at, now here's me, not a dentist, saying you might want to look at the mouth and how that's affected and take a look at some of these other protocols, that becomes an issue all by itself. It's an issue for you because you guys aren't dentists.
Right.
It's
There
kind
is.
of like if I've got somebody in the office who's a chiropractic assistant that's all of a sudden teaching chiropractic procedures and what I should be doing. Am I going to listen to that? And that becomes a real problem for you guys. And I'm sure you've come head to head with that a lot. It's because you've done this wonderful work and you've done some studying from a very, from very influential and powerful dentist, and you have the program down, but it's because you're not a dentist, are they going to listen to you? It's kind of like MDs, anyway, you get the point.
Well, I have heard that asked, who else is using this by dentists? They'll ask me, who else is using the software? I had a call, a conference call with an organization that has the dental and the medical clinic. And one of the providers in there, she was full-time thermography imaging, but she didn't have the outcome that she needed without the software. She said she needed to use the software. One of the dentists said, yes, I see how this is a great assessment tool and provides a report for us to see the dental medical connections. But the business manager was push back on it because of the possible lawsuits or the misdiagnosing or going into these areas of domain that weren't their scope of practice. So I gave them articles that showed that there is no quote right now regulation saying that a dentist can't look at a neck. So I think what we need is a collaboration of a template that's working to give the doctors confidence. An area, and I've been trying to find this location in California or on the East Coast. I can't seem to find anyone in the Midwest yet, but they're teaming up and just say, here's your template, doctors and providers, look at how everybody's working together. I did have a chance years ago to work in this domain in Santa Barbara, California. I encouraged a dentist to create Santa Barbara Dental Spa. And it looked like a spa. It looked like a spa when you walked into this, and it was right by the ocean. And we had a medical doctor, we had a massage therapist, we had the dentist, and they had myself. And I look back now and I think, wow, I didn't know how valuable that was. I just knew that it would be needed based on the chirodontics training that I had been exposed to. But at the same time, over time, the medical doctor left because he didn't feel that he was part of the diagnosing in the system. There was no system in place. I didn't have my software running in there, but if we have something similar with a system in place where the person comes in, the patient, for their assessments, and they see the dental medical links, now you have some concrete substance to work with, and people can see, oh, I can take care of this and I can take care of that. It's an architect, they said, supposed, forming out the architect design, but assessment is key. And a template. I see these doctors really wanting to see where it's at. Is it working? And they're kind of gun shy to even take the risk, so to speak, of putting something new because it doesn't seem to have an insurance code, which it actually does have insurance code. And they're doing more cross-code billing, medical billing inside dental practices now. So where do we help them build the confidence? We can teach them the systems. We can teach them the models. There will be the brave ones that will just do it. I've seen them. They'll be excited about it and want to do it. And also the certification, believe it or not, of dental physician. Dr. Fonder talked about that and having the identity. So they have that confidence to know I'm not just drilling and filling and billing, but I'm actually a dental physician. I work with chiropractor, a naturopath doctor, a DO, or an MD that are all working together to look at the systems in the body, those biosystems.
You had mentioned that the dentists in Europe were medical doctors first and dentists.
Mm-hmm.
When they became a dentist, did that stop them from being able to work as a medical doctor?
Apparently not so. They just specialized in dentistry and focused on dentistry.
Where over here, you don't have the option of doing medicine and dentistry.
Right. They kept it.
But you end up with enough schooling to be a medical doctor and a dentist, but
Oh, you do.
and so I think that kind of creates a problem.
Well,
But
what if we
okay, so I
portray?
have an idea.
Yeah.
I have
Okay.
an idea. Maybe this would be something, a good starting place.
Sure.
I'm working right now in setting up, helping one of the medical doctors that I trained recently, and he has a couple offices and a lot of staff. They have in one office, I think they have 10 different practitioners. And so what we're working on is setting up an office where I would go and manage this portion of it. It might be interesting, and once we get it up and going, to add the thermography and the dentistry to it and bring a dentist in, because this is all holistic. So you'd have to find a holistic dentist to be interested in
Mhm.
working. But I can, as we're working on things, I can bring that up and talk with them. But but of course, I'd like to know a little bit more about it and how everything works. But
Mhm.
if we had a model of it
That's
working,
what we need is the
if we
model.
had a model of it working and it was really working, then we could
Then
then we
it
could say,
functions.
okay, look, here's the model. Because what I really want to do is turn this into a training center
Yeah.
where I go once a
That'd be
month
great, Shirley.
and put on trainings for people to go to. And then while they're there, they can stay a period of time, whatever that
Observe.
period of time is, I haven't
Mhm.
determined yet. And just follow our people around and find out how they do it and what makes it successful so they can go home and implement it in their own facility.
Absolutely. And they
Because right now
will.
I teach people how to do it and I
They
tell
will.
them what to do, but I think when I had my office, we were a postceptor, um, licensed as a postceptor for the school. And the school would send people over, or we would interview people that came over and decide who we wanted to train. And oftentimes I'd have 3 or 4 doctors, who are doing their postceptorship following me around. And so I'd walk in a room and see a patient. There'd be this little group of people with me, and
Mhm.
that was very common, for many many years. I would just have people following me to see what I did and how I did it. And then usually we'd end up hiring them afterwards. That's why I want to be careful who I train, because if we like
Right.
them, we just hire them and then they would get to work there too, which was really a nice way of doing it. And so we could do the same thing in this training center and they could learn both. And then it might be something where you guys could come train too, and with your
Oh,
specialty. Just
absolutely.
just
And
getting it
that's
started, getting it off the ground
right.
and get it accepted is not
Yes.
going to happen in a day.
Right. But there's a desire for it. And there's also on the consumer side, they're worn out. I must get asked on a weekly basis
Yep.
what dental office they can go to that is holistic, truly holistic, meaning do they work with a team? I haven't yet found yet. They're dabbling like these wellness clinics that have the medical and the dental clinic or they're the doctors together, but I have yet found systems in place for these types of assessments and in using. They like the idea, but what they need is some hand holding. They need some hand holding to see the systems in place.
But the other problem that you face is that what you do holistically, for instance, not leaving dead teeth in your mouth, taking the, changing the fillings to something that maybe is not as dangerous, and those
Right.
type of things are expensive.
Oh, yeah.
Rather a root canal is expensive enough, but to pull that tooth is a price, and then to put an implant in there is a price, and holistically is an implant okay? Also, I mean, there's just so many questions about this, and I would bet that if you took 100 people that were over 60, that almost 100% of them have teeth that they didn't replace because they just don't have the money.
Well, not only that, but they have teeth that have been taken out that have left bacteria in the bone, and they have what's called cavitations, and they have the pus sitting in there, and it's draining and it's going into their body. That's
But you can
just
see that on X-ray, right?
Oh, we see it. But you know what? Not so much as I see it on thermal imaging. I see it right away. X-ray, by the time you see it on X-ray, it has to be more advanced disintegration of the bone. So early indicators are always going to be, yeah. And
You know,
also,
and look at that. You know, to get rid of that, it's like a
Yeah.
surgical procedure.
Yep.
well,
Surgical
that's why I
And
have
massive antibiotics, which is not
no,
holistic.
it's not going to, no, it's, I say,
And,
yes, yeah.
I mean, there's the mouth is a very important thing, but it's a very, very expensive thing. And as you get
Well,
Which
older,
is
every
why we
six
have
months
to
you go in,
start
the dentist finds
early.
something.
well,
We
Right?
also
have to,
it's about detoxing the body as well. The body will innately has an intelligence to detox and heal. That's where
Yeah.
the vagal nerve comes into play.
Yes. And Shirley hit it right on the nose. She said you have to start early. And this is something that
Right.
the dentists have been educating and educating about. You need to show up every 6 months. From the time you're a kid, show up, get your cleaning, take care of your teeth. If a problem comes up, take care of it right away. And then you end up as an older person with pretty nice teeth, other than the fact that they get weak and break and things. But still, if it's taken
Mhm.
care of, it makes a huge, huge difference.
In the quality of life too.
And the quality of life. And that is not really taught well. The dentists have done a good job of teaching people, whether they do it or not, to come in and get their teeth cleaned
right.
and to fill the cavities before they end up turning into a root canal or loss of a tooth and those type of things. But they haven't done the greatest job in educating about, you know, some of these other things. Like last time I went to the dentist, they didn't get my teeth hit on the right before they hit on the left, and now and you know, and last time I went, I said, "Oh, it's not that bad. Don't worry about it. It's not a big deal." And now my right TMJ hurts. And I'm like, so
No kidding.
I'm going back in
So
to
yeah,
talk to them again.
there are definitely improvements that can be made for
And
real.
then, you know,
And
and
I
then
just,
then you don't
Right.
want them to like grind your enamel away because you don't have a whole lot of that.
Right.
How do
So
you
here's
how
the
did
thing.
it get out of
Yeah,
occlusion?
I was just gonna say
What
what
happened that made it all of a sudden you've been using your teeth your whole life and suddenly this hits first over this? What happened?
What happened is is a filling.
Yep,
Yeah,
you got a filling.
yeah, that's
Yeah.
exactly what happened.
And then what did he use to determine where exactly it was hitting first?
Litmus paper.
Yes, carbon paper, for real.
And were you laying down when it was adjusted? Were you sitting
And
up?
now the whole side
Yeah.
here hits at
Yep.
once.
Yeah.
It's like the teeth have all moved. So now what do? Grind them all down so that this,
Yeah.
or
Well,
do you
no,
build
you
this
were
one up
laying
or-
down. You were probably laying down when he adjusted your bite,
Right.
not sitting up. So adjust the bite while you're sitting up because that's how we chew, not when we're laying down where the jaw
Oh my
drops
goodness.
back.
Oh my goodness.
Yeah,
Yeah,
it's
here you go.
these really simple, like, no kidding kind of things that
Yeah, it's kind
are
of like
still happening. Yeah.
it's like chiropractors take standing x-rays, and people have made fun of us for years because we don't lie the patient down on an x-ray table to take x-rays. But that's where we live. We don't live lying down.
We don't live lying down. No.
And you can't get good measurements on scoliosis and on, you know, leg
Not
lengths
when
and
they're
all
laying
those kind of
down.
things.
No.
And so for when you're lying down because everything changes.
And the gravity of it, right? So,
The back
and
This
feels
was
the
such a
back feels
good
fine when I lie down.
conversation. It's amazing that we've already like whittled away a whole hour. So
Well, thank you
so
so
our
much for having
solution
me
is,
on your
yeah,
podcast.
we like to
Appreciate it.
give a couple of solutions at the end. So what are our solutions?
the model, create the model.
Well, you guys have a solution. You have a solution on your side. You're doing your thermography. You're doing
Right.
your work with the
True.
muscles and
My
bones and everything in the face. You have a solution, and I have a solution. The
Yeah,
biggest solution is how do we pull that together, and
Teamwork.
who do we give it to?
Mm-hmm.
You have to give it to the dentist because they need to do that kind of work. And
Mm-hmm.
now I'm bringing my work into a dental office, which is actually holistic work. Will that holistic work interfere with the dentist's license? There's just a lot of things to consider. So, but I don't see a problem with
I'm gonna switch that
theoretically
just
with
a
us
little
working
to
together
give
and
a
creating something. I just wonder how it's going to work in the office.
Once you have a different perspective, then it gives it another little boost. For instance, when orthodontists expand the arch of children at 6 and 7 and younger, that age, their bedwetting goes away. I think it's an 80% cure rate.
Wow.
Is the orthodontist curing enuresis? No, they're curing a deficient maxilla. So it's an ipso facto, right? So he's doing the work, the treatment is working, but he would never put on his website that he treats enuresis because that's obviously out of his scope of practice. So how can you twist your method so that it isn't encroaching on some of these other domains? When I'm treating, I'm not treating sleep apnea, but once I get the tongue up and out of the way, it improves by 50% for real. So can I put on my website that, we're curing or even treating sleep apnea? No, not really. So you have to just, come at it in a little different way.
You could put up that when we spread the maxilla, that 80% of bedwetting goes away. You could tell the story.
I don't think you can put that on a website.
Oh.
So that's not what I'm getting at. What I'm trying to get at is for you to come up with maybe a different way, because I still don't know what you do, to say that you're going to do these things in your scope of practice, and very often these other things disappear. Something along those ways.
Well, yeah, that's a challenge for me every day.
Yeah.
But right now,
the dentist can kind of get engaged and not be afraid.
You know what we might have to do for a dentist to make everything work well is not go holistically at all, but put a chiropractor in their office.
And Julian, I've been working on that for a long time too. I mean, it's just, just chugging away. I've been doing that chiropractor routine for 15 years easy, and I never met you before. So, we just keep chugging away and keep chiseling and find younger voices that have more energy to take on some of these tasks.
That's where the model comes into play.
Exactly.
See a model.
Gotta see something at work.
If the dentist becomes a holistic dentist, did he get chased by the board?
Yes, he can.
Well, biological dentist.
This is how I go around that. That's a W. For some reason, we've dropped the W off of holistic. And if you add the W back on, it's just the whole body thing. Can a dentist hire a chiropractor? Yes. Can a chiropractor hire a dentist? Yes. So these are problems that are solvable, I think.
I think that might have to be the way to go, because if I could go into a dental office and train a dental hygienist to use my protocols, and then the dentist could send people over, and now all of a sudden the dentist is getting people well from all kinds of things. But would the board go after him for that?
Only if they advertise it and tell patients that that's what's happening.
So if you didn't advertise,
you have to have a dental reason. It'll give you more tongue space if I do this maneuver.
But you'd have to have some documentation that working on the neck helps the.
There's ways around it. You can get it. You just have to be a little creative.
Okay. Well, the big deal is what we want to do is bring health to people. And
exactly.
a dentist has a lot of people that come through in chronic pain that don't know they can get help. And if you had someone in the other room doing the testing and giving the care, he would have all these people getting well that didn't get well before. And it's a big deal for a dentist, a big deal for me to see it move into that arena.
And it can.
But then again, it's going to attract some attention.
And it can, and it doesn't have to necessarily be under the same roof. They can just be in collaboration, like we talked about. And that's where you have the team coming into play. Like we can wrap this up here
You
and
know,
close out
that
our,
was
yeah, go ahead, Dr. Paul.
way to go, Virginia. That's really brilliant. If they were in the office next door, that nobody would say a thing. It was just a referral.
Mhm.
Yeah, just a referral. But the patients won't have to go like this and try to find somebody that accidentally, is on the same page. So
Exactly.
it would really solve a lot of problems if the
I
I
model
think we just solved the
included
whole problem.
Yes,
a referral network, yeah, under one roof.
yes.
Yeah.
Thank you so much for being here. Thank you
welcome.
for
Thank you
Solve the
exploring,
problem.
exploring some of these
Nice talking to
problems
you
with
guys.
us.
This was good.
Yeah, I think so too. And
Shirley, are you
Victoria,
coming to Las Vegas when we come down there?
Yes, I'll be here.
Okay, and Shirley, you too?
no, I don't think so. I'm on a travel moratorium right now. I'm just chugging away at home. I was gone a lot last year.
Oh, yeah, we're hitting the road again. I've got 6 states I'm going to be in March.
And let's wrap it up where everyone can find us, right? So I'm on right now, Dr. Links, LINXS.com. And we have your seminars listed, Dr. Paul, on our directory.
Good.
And we have my information for the scans. And the goal is to get the collaboration just started. Just get out there and just start the referral listing. And Shirley, where can people find you?
My website is primalair.com, and one of our therapists has taken an interest in doing the social media. So you'll be seeing a lot more on LinkedIn, Facebook, Instagram. I think that's it. I don't know. So, and YouTube. I've been putting a couple of more videos up on YouTube, including this one. So that's where you can find me.
Great. And Dr. Paul, where can people find you? You're going to be really busy.
At pain-academy.com. Where's that, a hyphen, a little mark in the middle? They call it a hyphen?
Yeah.
Pain-academy.com. And that should get you there.
Great.
You have a very interesting video on some of the outcomes of your treatment. So
yeah.
that's
I've got hundreds and hundreds of these, and I it's kind of like, how many do I put up?
Yeah, I know.
I think what I'm going to do is
where do we stop?
It's just I think I'm going to end up just putting up a lot. I just posted 3 last night on TikTok.
See you, everybody.
Well, thank you so much.
Okay.